You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In podcast by Nurse Junior and Anthony.
You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In podcast by Nurse Junior and
Nurse Anthony.
All right, we on episode 3 right now.
Yes, sir.
Oh man, it's been good so far. You know, we saw the edits for episode 1 and episode 2.
Yeah.
How are you liking it?
Yeah, so far so good. I think it's just like a learning curve, you know? We're finding out what works for us and what doesn't, and yeah, we'll figure it out, man.
Yeah, we'll figure it out.
So far, though.
Yeah, I like it so far as well, too. Like you said, learning curve. Hopefully we can get, we're on episode 3 right now, so after this, so maybe 6 more down the road, and hopefully post them on, I want to say, June, July.
Yeah, let's go. I'm excited, man.
So we'll see, yeah. So on this episode, you know, we're going to talk about the graduating class of 2024 right now.
Congratulations.
Yeah, congratulations. Welcome to the real world now.
Oh, man.
Whatever you guys learned, you can throw that shit out the window because right now, once you guys pass that test and get on the unit, that's when the real learning starts.
Oh, absolutely.
You know what I mean?
Absolutely. You know what? One thing I feel like school doesn't prepare you for, and this is regardless of where you work, whether you're at the hospital, you're at a facility, you're in the community, I feel like you're never really prepared for all the personalities you have to work with.
Oh, that's a fact.
Oh, my God. I felt like, and I still feel like, that is the hardest part of navigating through nursing. You know what I'm saying? Like, once you get patient care down and you know how to deal with families and patients, and you walk out that room, it feels like the job doesn't end because you still have to deal with all the personalities you work with. Exactly.
No, I agree. I agree completely. Yeah, you're dealing with a wide spectrum. Older nurses, younger nurses, nurses that aren't even on the unit that you're working on. You know, they may be floating. Just different experiences all into one on one unit. No, you're right about that. I remember, you know, when I graduated, I kind of knew what to expect because I had a lot of OGs in the game that told me what it's like, but you know, you don't really know until you go through the motions.
Oh, for sure.
So like, as soon as you graduate, pass that test, and actually get that first job, and then step on that unit, that's when it really hits you. I know. Like we'll go into this one story that I experienced in my first job. It was the neuro ICU. You know, there's this one girl actually that told me this one quote. Her dad told her this quote, and she told me, and it always stuck with me. If you're on time, you're late. If you're early, you're on time.
Was her dad a Coach Carter? That's what that's from.
Is it? Yo, that's crazy. Oh, damn.
That's crazy, bro.
I never even took that in.
Yo, her dad is trying to teach her some wisdom from Samuel L. Jackson. That's insane, bro.
But yo, that quote always stuck with me. So when I heard that quote, I'm like, damn.
That's so
you know,
funny.
That makes sense. When you're on time, you're late, and when you're early, you're on time. So as a nurse, I was always like 30 minutes, 45 minutes early to my shifts. Oh yeah,
still
till this day.
Wow.
I'll come to work 30 minutes early, look at my patient charting, make sure I know everything about my patient in terms of health history, allergies, how their day went through the notes. And, you know, I'll kind of walk into the unit, and from there I want to see, all right, who do I have today? Sometimes the patient board isn't even done.
Yeah.
In that 30-minute.
By the time you get there,
yes. It might get done 7 p.m. or 7 a.m. on the clock.
Yeah.
Which kind of pisses me off sometimes.
That I could see. Yeah, that would be annoying.
Yeah.
Wow, you get there that early.
I get there that early just to make sure no BS is happening.
Yeah.
You know, sometimes you could come onto the unit and you see everybody chilling on their phone or doing something silly.
Yeah.
And the next thing you know, you get reported. It's like, oh man, we had a shit show today. And I'm like, what do you mean you had a shit? Y'all were just chilling. Y'all were just on your phones gossiping. You telling me you had a shit show? Oh, hell no, man.
Wow, that's crazy. Because, I mean, I'm sure some of my coworkers are going to watch this, and they're going to tell you, I am the complete opposite, bro.
Really?
I'm not walking out onto the unit until 7 a.m. or p.m. It's just not happening, bro. Like, even if I get there early, which early is 10 minutes, bro. Coach Carter would be disappointed.
Sub him out.
Yo, like, I think, nah, bro, I just can't. I can't. And honestly, but we're also speaking from two different, I think when you're in more ICU and critical care units, you kind of have to take the time to really, really get to know your patient before you step on.
Definitely.
Being like a step down ICU and a medical or med surg, I feel like, not that you could just walk on and do the job, but I feel like I can get report and I can take another 15 to 20 minutes to look up my patients, and I think I'll be just fine. You know?
I can
and
see
I feel
that.
comfortable enough to know that I know my patients enough and know how things went.
Okay. Yeah.
To take care of them adequately.
I can see that. Yeah. Yeah, because with me in the ICU, it was I did that more so out of fear. You know what I mean? I knew that walking onto the unit, I knew that I was dealing with a patient that may be on the brink of dying if you're not paying attention. So they may be on drips. They're intubated, which means they have a tube that's going down their throat and it's helping them to breathe through the ventilator machine that's beside them. There's a plethora of things, but for me, it was more so out of fear that I knew I had to be there 30 minutes early and know what I'm dealing with for the day.
Yeah. But let me be clear. I feel like when I started, I was that guy.
Yeah.
I'd go early. Even when I moved back home, I was that guy. And then, so I was on telemetry, so that's cardiac.
Yep.
And I've never worked at a place with more senior nurses than that unit.
Okay.
And there was this nurse I used to work with, man. I still love this dude to this day. His name's Tony. Shut up, my guy, Tony. Where one day I was running late, and I'm running. So at this point, I'm getting to work like 20, 25 minutes early, you know?
Yeah.
This day, I'm coming up 5 minutes before. I don't know what it was. I can't even tell you. I'm running. Tony's like, I meet him in the elevator. He's like, why are you sweating? Like, why are you running? Why are you breathing so hard? I was like, yo, I'm running late for work. He's like, bro, it's like 6:53, bro. We're on time. Like, you're good. And I was like, bro, you're not worried about He's like, worried about everybody else. He's like, dog, we don't start work till 7. It's 6:53. We're early.
Touche.
Since that day, I was like, Tony, you're not wrong, bro. And since that day, I've been like, if I get there at 6:53, I'm early, bro. I'm good. I'm good.
Yeah, man. So, this goes back to my very first shift as a nurse, and I think I told you the story a while back. It was the neuro ICU, and my first shift ever. I'm off orientation. Orientation lasted 6 months. 3 months of my orientation was in a computer room doing modules, just learning about different things within the ICU, whether it be, IVs or arterial lines, ventilators, whatever the case may be. Then that other 3 months, I'm now placed onto the unit with a veteran nurse, and they're pretty much taking me through the motions, right?
So for 3 months, you're not at bedside at all.
That first 3 months, you're in the computer lab, just learning about different aspects of the ICU.
That's incredible.
Yeah. Then the last 3 months, you're with the actual nurse, a veteran nurse, and you and that nurse have a patient together. You're more so doing the work, and then they're kind of like shadowing you,
Right.
making sure everything's done well. But that's how it typically went, or how it typically goes in the ICU for the most part. I worked at Detroit Receiving Hospital, so it was a teaching hospital. Very, very good facility starting off.
Yeah.
But anyways, so I'm now on my own. I make sure I come in 30 minutes early. Granted, the damn board ain't even done.
Yeah.
It was a busy day, so I mean, I get it. But, they finally give me the assignment, and I now look on the board. My name is up there and the room number. So now I'm looking up the patient. I'm like, damn. So the patient that I got was, and mind you, at this point, I'm 22, 23. This patient's 21 years old, female. And the story behind her is she got in a motor vehicle accident. She was in the passenger side, and the boyfriend was speeding. I don't think she had her seatbelt on because she got ejected from the windshield 30 feet. So I think what had happened was, if I recall, the boyfriend was speeding. He hit the median, which is like the middle side of the highway, crashed. He was still intact in the seat.
Yeah.
But when paramedics came onto the scene, they had seen that he was still there, but someone had gone through the windshield.
Oh, man.
So I think it took them maybe about like 5 to 10 minutes to pretty much find who it was that got ejected through that windshield.
Yeah. That's crazy.
30 feet.
Holy.
No seatbelt. So he must have been going about like not even, maybe, I don't know.
Yeah.
But he was going fast to the point where she got ejected 30 feet.
Yeah.
Anyway, so that's my patient. I remember she was in room 2. It was crazy because her mom was in there just crying.
Yeah.
And crazy enough, she was Canadian. I think the injuries that she sustained were too much for the facilities here.
Right.
So they had to bring her across the border to Detroit, Michigan. So mom was just crying, praying. As soon as I walked in, oh, is my baby gonna be okay? Is she gonna be? I'm like, miss, don't worry, everything's gonna be okay. She's in the ICU right now, so we're gonna do all that we can do.
Yeah.
And I remember, I told her to step out because I wanted to get a report from the nurse. So the nurse is giving me a report, and bro, it's just a lot. So like on the first, I was so overwhelmed because one, all these lines that she had about like 4 or 5 IVs, multiple drips. I'm talking like Levofed, which helps to like stabilize the blood pressure or bring it up. Then she's on propofol to help sedate her. She's on the ventilator. She has I think she had an OG tube. She's getting 2 feedings. Just a bunch of stuff for a rookie nurse that's coming on for their first shift.
Absolutely.
So I'm just there like, yo, y'all couldn't give me a easier assignment for my first day. You guys couldn't, warm me up so I could get my feet wet. They just threw me into the fire, bro.
That's so funny.
I'm like, God damn. So I'm getting a report, now the nurse, she steps out. I'm just standing there. Now the respiratory therapist, there's a respiratory therapist, black lady. She walks in and she's just like, She's like, Like she's just like, damn, like what did we walk into tonight?
Right.
Like this is insane. So she's like, She does her whatever she writes down. She just walks out, just shakes her head. Bro, it was a rough shift. And for me, it was kind of intimidating because me, like I said, I'm 23 at this time, and I'm dealing with a 21-year-old female who just sustained a head injury. She also had like a drain to the head, which is called a EVD, endoventricular drain,
right,
which helps to help bring down the intracranial pressure and, cerebral spinal fluid, drain whatever is within the head to help decrease the swelling, whether it be blood or, like I said, cerebral spinal fluid. But yeah, like it was just overwhelming, bro.
For sure.
But she was in the ICU for like maybe 2 months, and then she probably went down to like med surge or whatever unit
That's a
it
long
was.
time in the ICU.
Yeah, 2 months.
Wow.
2 months. So I had her for like a good month, just back to back to back, because I was just familiar with her.
Right.
But yeah, that's probably one of the craziest first days of nursing in my life. Yeah, as a shift.
Wow, that's incredible. I feel like for me, and I still kind of, this holds true. Not that I'm like top nurse or anything, but I've never really been in that position where I feel overwhelmed with not any single patient. Maybe if like my whole assignment, there's just a lot to do for a patient, I might feel overwhelmed. I feel like early on in my nursing career, I was worried about a lot of the wrong things. Like the things you were worried about seem so like justifiable to me, right?
Yeah.
But I felt like when I first started at the hospital, I was like, oh man, I hope I'm really good at giving report. Let me hone in on my report giving skills.
No, I was the same way.
You know, and then it's like there's kind of a checklist you have in your head of things you make sure that's done before the next shift. I'm like, oh, let me make sure all these things are done, you know? And I mean, don't get me wrong, patient care is still there. But for me, it was like, these are the things that I want to be good at. And then now when I train people, like, I'm like, bro, don't worry about that. Like, that means nothing.
Yeah.
You know what I'm saying? Everything that you're going to tell this nurse is on the computer anyways. Like, it's on their chart.
Facts.
Whether you tell them or not, at some point in their shift, they'll read it and they'll figure it out. But let's make sure we do all the important things first. And all your report stuff and all the little stuff that, of course, it's important, but aren't the real important things. All that stuff will come together.
You're so right about that. Looking back at it, you're right. There were a lot of nurses that just cared about the wrong things when it was time for a giving report. For example, like me when I started off, I'm not gonna lie. Sometimes I would leave a little clutter on, in the room or on the counter, a bunch of junk. You know what I mean? Like whether it be multiple straws, cups of water, I would never get rid of it, and that's the nurse's main concern. It's not the main concern right now, man.
That's right.
Like, let's focus on the patient. If you want, I can handle that later.
That's right.
Why are you complaining? I know your OCD's kicking in or whatever. Forget all that.
Yeah.
This is what's going on with the patient.
Yeah, that's right.
So I think you're right about that. I was worried about the wrong things. And I'll even take it a step further. You're mentioning, when you're giving a report, you're afraid of forgetting something. How about giving a report? How about communicating with a doctor over the phone?
Oh my goodness, bro.
I'd be in the bathroom practicing in the mirrr, like, yes,
100%.
Doctor, my name is, this is the patient. Like, I'd just be practicing it because.
And then in school, you learn like the S bar before you call the teacher. You make sure.
Forget about that shit. F the S bar.
Yo, forget about it. Look at me. Forget about it. All right?
Nonsense. S bar, I've never used that in my life. I don't even know what the acronym stands for.
It's like situation,
background assessment. Yeah, fuck all that. Forget about S bar. Just do your thing. Just, you know what I mean? You'll know. Because most of these doctors in the facility, they're chill.
Yeah.
I remember I was trying to do the S bar to one doctor. He was like, Junior, you know me. What are you doing? Tell me what the hell's going on with the patient. What medication is he on right now?
Yeah, for real.
You know what I mean?
And as you work at a facility, like the doctors, like you get to know these doctors, and they're just like, yo, just hurry up and tell me what's wrong.
Yeah, because I got other people I got to see and things to do.
Yeah.
So that was one thing I was really...
that was a big thing. Like, I can remember I would write stuff down. Make sure you don't forget to tell this.
Yeah.
You know what I'm saying? And I would write down, and then they'd ask me a question of something I didn't write down, and I was like, and then you're just like, oh, what do I do now? You know, man, I think you just need to take a breath. You know your patient, you know what needs to be said, and you know what you need the doctor to give you a lot of the time. You know what I'm saying? So the biggest thing for me, if I could give anybody advice, would be honestly just lean on the staff around you. Like, I feel like even now till this day, I'm not 100% sure about everything that I do. I have no problem asking questions, whether I may sound stupid or not. Regardless, it's not about me. It's about the patient that I'm caring for. You know what I mean? So if I'm unsure about something, I have no shame in asking.
100%. 100%. Yeah, I think to all the nursing students that are graduating right now, writing their NCLEX, and they get started on the unit, just take your time. Whoever you're orientating with, ask them as much questions as you can. Don't be afraid to seem like a dumbass.
100%.
Because at the end of the day, there's going to be situations where everyone's going to forget something and they're going to have to ask somebody for that solution or that answer.
That's right.
So that's what it comes down to, honestly. It's a team sport. Nursing's a team sport.
100%.
You know what I mean?
100%. I feel like that gets lost a lot. That's exactly what it is. It's a team sport. You lean off each other, you learn from each other, and then your 12 hours is up and you get to go home, but it's definitely a team sport.
100%. Yeah. But yeah. So that's
what else? So for you, first coming out, like when you finished school, what was that preparation for the NCLEX like?
So when I finished school, the preparation for the NCLEX, honestly, I took some time off for myself to really just relax. They gave us this program called Kaplan.
Okay. Kaplan,
it's like how can I explain? It's like a testing system that you do online. So it gives you multiple questions, practice questions essentially. And they kind of create, I guess, a curriculum for you. So you're doing like 100 questions a day, different topics, and then from there, you kind of just compare your scores from a day-to-day basis to see how you're doing and where you need to focus more on. So that was the platform or the resource that I used. On top of that, I went to the library almost every day.
Yeah.
I was in the library for like 6 hours a day, 6 days a week. So that was or 6 times a week. Yeah. So I think the process for the NCLEX, it was tough. I'm not going to lie. I just didn't know I didn't know what to focus on. There was just so much. And the day of the NCLEX, it was crazy because it was a rainy day. I walk in, there's like maybe myself and 6 other students there.
Okay.
All females. So I was the only male. I sit on the computer. I start. And, well, first off, when you go do your NCLEX, you got to sign in. They take a photo of you. And then from there, you put all of your belongings in.
Like a locker.
In a locker, right.
Yeah.
From there, you do that, sit on the computer, and then you begin. They ask you a few questions. I want to say they ask about your race. They ask about your age. I think the school that you went to, and then you begin the test. So with the NCLEX, minimum 75 questions. Maximum is, I believe, 265 or 275.
Okay, yeah, I remember that.
It might have changed throughout the years currently right now. They may have decreased it. I'm not too sure, but that's kind of where that's the ballpark range for the minimum and maximum questions.
Okay.
I was there up until 265 questions.
See.
I was nervous as hell, man.
Yeah.
I'm nervous as shit because it just shuts off. And at this point, you don't know whether you passed or you failed.
That's right.
And the thing about the NCLEX too is, and this is just from, at this point in time, I'm hearing from other people, oh yeah, I finished in 75 questions. Yeah, I finished in 75.
Yeah.
And to me, it's like, damn. Y'all finished in 75? I finished at 275 or 265, whatever it was.
Crazy.
At this, and then when it shuts off, your heart just starts thumping.
100%.
It's like, yo.
And you think the worst.
You think the worst. Because now in my head, I'm thinking, okay, if I went to the highest amount of questions, I must have fucked up somewhere.
100%.
But then at the same time, you got to think about it like this. If you shut off at 75, you might have been answering questions wrong too.
Yeah, but I feel like when you're in that moment, regardless of... Here's the thing. I feel like when you're in that moment, regardless, you always think the worst. But then if there's more people that are in your boat, you almost feel relieved. It's like, oh, you had 275 too? Oh, you had 270? Okay, maybe I did something right.
Right.
You know what I'm saying? Whereas when you're by yourself, you're like, oh my God, what did I do wrong?
Yeah. So it kind of brings me back to like when I was actually in nursing school, right? So when you're actually doing exams in first year, second year, third year, fourth year, when you finish doing your midterms or your exams, the first thing we all do is we go into the hallway and we all converse and talk. Yeah. Yo, so what for this question? What'd you put for that? What'd you put for that? Foley catheter question.
Yeah.
That's kind of where my mind was at. So I'm like kind of talking with the girls that were there. Mm-hmm. Like, yo, did you get this question? Did you get that question? But no, it's different. Mm-hmm. It's all different questions. You don't get the same thing that person got.
That's right.
You don't get the same questions that person. You get a whole different exam.
Absolutely.
And I remember specifically, I got maybe, and I shit you not, it was about 10 OB questions back to back to back to back. OB is labor and delivery. So mothers, birth, babies, those, I got 10 questions of those back to back to back to back to back. So at this point, I'm like, yo, what the hell is going on? Am I getting these right or am I just fucking them up?
Absolutely.
And truth be told, I didn't really study labor and delivery during my time in the library.
Yeah.
I was focused on other things. I didn't think I would get a question like that. Mm-hmm. So typically, I think with these tests, I don't know if you call them standardized, not standardized, but
it's not even, yes, they're comprehensive exams, but I know what you're talking about, where essentially the exam adjusts based on the answers, how long you take to answer, which ones you're getting wrong. I know what you're talking about. There is a name for it, and I can't remember.
Yeah, so if you get, for example, I got a labor and delivery question, something about a baby. I answer the question. Hypothetically, let's say I got it wrong. Right after that, the computer's going to be like, oh, shoot, this boy got this question wrong.
Right.
Let's fuck him up. Let's throw him another one. Yeah. All right, another labor and delivery question. Damn. Answer, got it wrong. Oh, let's throw him another one. Boom. So I think that's what was happening.
For sure.
So they kept throwing labor and delivery questions at me, left, right, and center. For sure. To the point where they were like, yeah, this guy doesn't know anything in this department or area.
What's crazy, though, you know what it could have been, too? Like, let's say if they started off the exam giving you questions for things you had studied on and remembered, it essentially tracks how fast you're answering the questions you're getting right as well. Mm-hmm. So let's say even if you get an answer on like an OB question right, but it's like, oh, he took 1:30 to answer this question.
Yeah.
Why did it take him so long? Let's see it again.
Yeah.
Let's see it again. You know what I'm saying?
That's exactly.
I hated those exams, bro.
So that was that. So, yeah, I didn't know what to expect. And I think it took about 2 weeks for my results to come out. Came in the mail. And it's funny because throughout that, so within the 2 weeks, there was this post online that said you can find out if you passed your NCLEX exam if you do this specific thing. And that specific thing was going back onto the NCLEX website where you register to write your exam. You put in your credit card information and try and rebook the test.
Yeah.
If it rejects you, it means that I can't remember exactly, but if you try and put in your credit card information, it'll give you this notification. Okay. If you get that notification, it means you passed the test.
Yeah.
So I did that. I went out to the website, put in my credit card information just to see.
Yeah.
I didn't get the notification. So at this point, I'm already pissed. I'm eating and I'm nervous. I'm like, shit, I didn't get the notification. Oh,
that's hilarious.
Then I hit up my boy, yo, did you write the NCLEX? Yeah. Did you do the thing that you saw on the internet? Yeah, I did. I got the notification. I'm like, fuck. So now mentally I'm like, shit, what the hell's going on? Did I pass it or did I fail it? 2 weeks comes, I get it in the letter. I failed the exam.
Oh man, that's
it was rough. It was rough, bro. I was depressed.
Oh, for sure.
I'm just at home listening to A Boogie, just in my feelings right now.
Oh, that's hilarious.
So after that, man, I think you know what really put me in a bigger slump. It was the fact that, and we come from the social media era. Mm-hmm. So now, Facebook was big for us. So was Instagram. Mm-hmm. So I'm seeing all of my peers that I graduated with. They passed the NCLEX, and the first thing they do is they post.
I hated that, bro.
I hated that as well, man. They will post the letter that they got that said they passed.
Oh my god!
They'll ink out their address.
Oh my god, bro! You're bringing me back.
They'll ink out their address
Holy.
and they'll show that this so and so passed her NCLEX.
Yeah,
I'm like, come on, like,
bro,
what? At the end of the day, we all gonna be working the same damn job, making the same rate. Is that really necessary right now?
The worst is now they're not seeing your picture.
Right.
Hey, Junior.
Yeah. It's like everybody was following that trend. To this day, I didn't even post my shit when I eventually passed.
Not one. And I did pass that first time, but I was not about to do that.
Yeah. Bro. Nah. I was not following that wave at all. Because at the end of the day, look at it this way. You're so happy that you passed the exam. All right. You happy that you're still a nurse right now? I met so many nurses 3 months into the job. Oh my God, I'm burnt out.
Oh my God.
I need a vacation. God. Well, you posted that you passed, so get to work.
Yeah, enjoy it.
Yeah, enjoy it. So I think that was one thing that really put me in a deeper slump was seeing everybody posting that they passed.
Absolutely.
So I'm thinking, shit, what am I doing wrong? Like, I got to change the way I'm studying, I guess, or got to figure out another method. But eventually the second time I wrote it again and passed. And it's funny, when I wrote it that second time, like I mentioned, they'll ask you your gender, your age, your race. Man, for a specific moment when I was filling it out, I said to myself, you know what? I'm not gonna put that I'm black. I'm gonna put I'm a different race or ethnicity.
I'm Caucasian.
I'm Caucasian today, right?
I identify as Caucasian today.
So, ma'am. So that's what I put. I put that I'm Caucasian, male. I don't even think I put the right age. Yeah. So, I feel like that had a thing to do with it, but at the end of the day, I passed it. So,
see, for me, when it came to mine, much like you described early on, like I was just lost. And I didn't know where to start studying. Like I was like lost.
Did you use one of those resources like Kaplan?
So I know a lot of people use like UWorld and all that stuff.
It's another one, yep.
So, but when I was in school, we had two professors that had prep courses, and they were advertising that, even though I know they weren't allowed to, but they were advertising that. So when I was studying and summer hit, I was like, I don't know where to start. So I emailed one of them and was like, hey, is there still space in your prep course? Like, I need some direction. She hit me back the same day. She said, yeah, I got in. And so I took her prep course, which, I mean, I think at the time it was only like $300, but it felt like a lot. So $300, I was like, you know what, whatever. And I think it was, I want to say like a 9-week prep course. So you go into a classroom for 3 hours once a week or twice a week. And she goes over a bunch of information. She gives you time to study. She gives you like a study guide and almost like a breakdown of study this on this day and this on this day, and just to keep you organized.
Right,
you know what I'm saying? Like looking back now, it was definitely worth it to do that prep course. And I mean, obviously, like I said, it helped for that first time I did it. So yeah, so for me it was good.
Yeah, I think they offered that to me as well too, but I think the difference was that they were offering it in Windsor. For me, I went back home to Toronto to study.
Yeah.
So I was going to like the Toronto Public Library almost every day to study individually, but I think that definitely would have helped out. Cause yeah, you're with a group of other students. You also have instructors that are kind of guiding you and teaching you the ropes. Cause there are certain ways that you can target the questions. If you look for specific words or the theme of the question, you can figure out and then look at the answer and see what
Correct.
makes sense and what doesn't.
So I think why mine was so, like the prep course I took was so helpful. One, I found out at the very end of, I don't know if to call it like a little mini semester, I found out that the teacher or the professor that was running it helped write the exam.
Oh, wow.
So she kind of gave us insight onto what you were just describing, where even if you don't know the answer, here's a few subtle little things that could point you in the right direction. So I think that helped me a lot with the questions I really didn't know. Even though I was guessing, I was like, okay, let me use these little couple tricks she helped, and let's see what happens.
Yeah. If I'm not mistaken, I think right now, in 2024, even in 2023, the NCLEX has changed so much as well too. I think I was talking to someone about it. Now it's like almost all the questions are select all that apply to the point where it can be A, C, D, E, or for example, it could be all of them.
Right.
So or it could be just A, B is the answer, and then the answers are A, B, C, D, E, and then all that apply. Like it's a mind F right now.
It absolutely is.
It's so it's hard to determine. And back then when I wrote it, it was never like that.
Yeah.
Now they also have audio clips. They have graphs, man, pictures. So the whole dynamic of the exam has changed.
Absolutely.
So it's like, man, good luck to y'all out there that are doing the exam right now. But I will say that once y'all pass it, it gets a little bit easier. It gets easier for sure. Now, they do rinse your pockets. They do take a lot of money from you.
Oh, they really do.
Because I think the exam in the U.S. side, it's about maybe like what, $340 or $320?
Something like that. I wrote mine in London.
Oh, yeah?
Yeah.
How come?
I think so. I didn't feel comfortable to book mine until I finished the prep course.
Okay.
And even when I finished the prep course, I studied for a little bit longer. And by the time I went to apply for my exam, everything was booked. They only give you specific dates to write it.
Yeah.
So I was like, oh, man, what am I going to do? So I started looking at like Toronto, and I was like, oh, man, that's so far.
It is 4 hours.
And then, yeah, luckily in London, there was like 2 spots left for a day that I could go. Because I was working like full-time at the time, too. And so, yeah, I just ended up booking London. I went there the day before and stayed in a hotel and studied.
Wow.
Yeah.
Impressive. Yeah, I know somebody that's from Windsor that actually went to Detroit to write it. I think I know one other person that went from Windsor to Toronto because, like you mentioned, it was booked completely. But yeah, I think the total price on the Canadian side was about $3 something, and then on the U.S. side it was about $200. So I think it might have been cheaper to write it in the States. I don't even know, but at the end of the day, it doesn't even matter because it's the same damn test, right?
Yes.
So, but like I said, once you pass that, it gets way easier. So when you first started off as a nurse, any interesting stories, or how was it being that rookie nurse?
That's a good question. I would say I don't really have any good stories starting out, just because for me, I worked in like an urgent care clinic starting out, long-term care, and I think they were places I didn't really want to be. It was just easy places to get jobs at first. So I didn't really care too much about the facilities that I was at. Not until I started at the hospital that I felt like it was more my speed. Just acute care is more where I wanted to be. And you hear so many stories about like the cliques around units and the cattiness of nurses and all
gossip.
these things, the gossip of nurses. So I think for me early on, even when I was in school, I never had an issue with patient care or dealing with families. Like, I'm always happy to call family members, whether they're pleasant or not. Like, I don't care. So just from what I was saying earlier, for me, it was always navigating the personalities I work with.
Right.
You know, because, again, I'm one of those guys that I like to lean on the people that I work with, ask them questions, bounce ideas off you. What do you think about this? And all these things. So for me, I was like, oh, who can I go to comfortably without judgment, I guess, you know?
Yeah.
So it was always about navigating through that. So, and even now, like, there's certain people I just don't like to go to, but, and then in terms of stories, I don't know, not really, man. I'm like the class clown. Like, I just joke around all the time on the unit. So I feel like early on, it wasn't easy to do that because, again, I'm trying to see what people are like that I'm working with. Can I be myself around these people, you know? And so it took some time to really, really open up. But when it comes to patients, I think because I wasn't in critical care, I always felt comfortable. I didn't feel like an assignment was ever too much for me. I didn't feel like, I don't know, I just took everything as like a learning experience, you know, and I never really stress out about things. So for me, it wasn't like, what am I going to do? You know, like, why this? For me, it was just like, man, even though this is difficult, let's learn. Like, that's what we're here for, you know?
Okay. So let me ask you this, right? How many years have you been in the game?
Like 6.
6 years.
Yeah.
So if I could ask you, not even ask you, but if you can go back in time and tell your younger self that's in nursing school, or not even nursing school, that just became a nurse, what's one thing you'll tell yourself, your younger self?
That's a good question. That's a good question. You know what, man? I'm really happy with my experience. Like, Ange and I went and did travel nursing pretty early on, like when I graduated.
Right.
You know what I'm saying? So I finished a year before, and a year later we were in Australia. So I think if I could give myself some advice, it would be just not to stress so much about anything. Like, even now, nothing stresses me out, you know? But I felt like early on I cared about what people thought. I cared about this. Like, you even come to work with your nice scrubs and, you know, like the way you talk to doctors is so different, and you're trying to not necessarily put on a facade. I mean, yes, you want to be your best self, but you're so afraid of being judged that you don't move comfortably. So for me, the advice I would give is just, especially early on, who cares about all that, you know?
Exactly.
You'll make mistakes. You'll get judged regardless.
You'll learn from those mistakes.
You'll learn, and use everything as a learning experience. That would be my thing. I think even when I made little simple errors, it was like, oh, I'm too hard on myself. You know what I'm saying? And then now I feel even more self-conscious. So it would be just relax. Like, things will come together. Don't be too hard on yourself.
Definitely. It's hilarious because you're right. Those new nurses that come onto the unit, they're figged out in their fig scrubs.
Oh my God.
Hair tied back.
Dude, you can always tell, even like, I could walk on any unit. I could be a float nurse and walk on any unit, and I could, without even talking to anybody, could point out the new nurses.
100%.
Like,
right off the rip.
100%.
They have that perkiness in their voice.
You know? Like, yo, it's 7 a.m. Don't talk to me, bro.
Yo, I'm telling you. And they got like the Starbucks in their hand with their mug.
Oh my goodness.
Here we go. For me, I think if I could tell my younger self, or any nursing student out there that's about to graduate or that's soon to be done, I think the one thing I will say to y'all is and this is related to giving out medications. Know the medication that you're giving.
100%.
Don't pull it out from the Pyxis. And yeah, because it's labeled there, labetalol, Protonix, whatever the case. You got to know what
100%.
the medication is and why you're giving it to them.
100%.
And I'll explain. It was 4th year for me. This is my last placement. I think I was on the respiratory unit or somewhere. I can't recall. But anyways, in 4th year, you're pretty much on your own. You have a instructor, but they're kind of shadowing over you. But my instructor was super chill. She's at the nursing station, gossiping, whatever, talking, cool, whatever. Junior, you giving the 9 o'clock meds? Yeah, I got it. Don't worry. I gather all the meds, go into the patient's room. And mind you, this lady, my patient, she's a nurse. I didn't know she was a nurse. And I come to realize at this time, now, nurses, we're probably the worst patients to have.
The worst, bro.
Because any little thing that you do that's a mistake, whether it's you forget to alcohol swab the hub of the IV or the port, I mean, oh my God, they'll be on your ass.
100%.
Like they'll write you up and they're not even working. They're a goddamn patient.
Bro, the worst.
So my patient's a nurse. At this point, I didn't even know.
Yeah.
I didn't read that in the report. I don't even think they put that in the report.
Yeah.
So, I'm I'm opening up the medication, scanning it at the bedside, of course. Make sure I check the wristband. Oh, your name is, date of birth. Okay, cool. Any allergies? All right, cool. Giving labetalol. Yeah, that's for your blood pressure. Protonix, also known as pantoprazole. That medication it's a proton pump inhibitor.
Correct.
Essentially what it does is it helps to reduce the stomach acid the stomach acid and prevents you from having gastric reflux.
Correct.
So the esophagus, your throat, like you just don't feel that burning sensation. At the time, I think I had said this medication is your antibiotic. So I said, yeah, this is your antibiotic, pantoprazole, Protonix. And she goes, antibiotic? I'm not supposed to be on an antibiotic. And I'm like, 1 second. So I scan it again, and you can like right click and then kind of see what the medication is, the information.
Okay, that's dope. I didn't know.
Yeah, I didn't know about it either until that moment. So I'm looking, I'm like, ooh. She goes, yeah, that's not an antibiotic. That's for my gastric reflux.
Yeah.
I'm like, oh, yeah, my apologies, miss. Yeah. And then she goes, listen, I get it. You're a student nurse. I've been there. I've done that. And I'm like, huh? You're a nurse?
Yeah.
She goes, yes, I'm a nurse. I'm like, oh, damn. She goes, listen, when it comes to administering medications, you need to know what you're giving. Because you may get another nurse who may not be as nice as me. So make sure you know your shit before shit really hits the fan and you give the wrong medication to somebody.
Right.
And I'm like, nah, that's real talk. I appreciate that.
You know what, though? Bless that lady, bro. Because I find a lot of older nurses forget what things were like in their younger days.
100%.
And I think that's my biggest gripe with a lot of the older nurses that I work with. And when I say older, I mean like 5 to 10 years in the profession even. That's my biggest gripe. They act like they've never made a mistake. And they judge people for making every mistake.
Yep.
So, I mean, for any newer nurses out there, if I could give you another piece of advice, just be easy on the younger nurses. Like, they're going to make mistakes. And just remember now, while you're young, what it's like and how uncomfortable you are. Because you will meet those newer nurses that are going through the same thing. And when they feel that judgment, they're more prone to make mistakes and not come to you when they do need help. I think that's the biggest thing right now that I'm trying to, navigate people through.
100%. I think another thing that I want to talk about with the new grads and coming into the game is your report sheets. I think that's a very important thing that that should be discussed about today.
Right.
When I came in to the nursing game, a report sheet essentially is information about your patient that you have for that shift, their age, name, allergies, past history, medical history, et cetera, et cetera. I was that type of nurse that would make a report sheet, and I would make it detailed.
Oh, extremely.
So detailed that the next nurse coming on would be like, let me have that.
I've done that too.
I do that now myself. I do that now too. Okay, let me have that report sheet. Bro, to the point where they'll be like, yeah, but I need it back. I'm like, all right, don't worry, I got you. It's gonna be back.
Yeah,
I'll just photocopy it.
that's right. You know what I mean? That's exactly what I do.
That's what I do nowadays.
Yeah.
But back then, oh my God, it looked like a goddamn, it was an essay, like,
oh my goodness,
like a damn journal.
Yes.
So the reason why I bring that up is it's important to do. Always keep that with you, because it's just, one, you may get that patient back the next day, the next week, maybe the next month. Most of these patients are frequent flyers.
Absolutely.
They'll always come back. They leave, they come back. They're non-compliant with their meds. They're non-compliant with education. Most of the time they'll come back, and now you have that same report sheet. You read it over and you're like, okay, this is Mr. Jones. I've had him before.
That's right.
So it happens to me all the time, and I think that's an important thing for these new grads that are coming into the game. They need to know about that, the report sheets.
Yeah.
And honestly, I wish I saved all of my report sheets, because looking back at it, they could have been used for most of these segments that we're doing.
Yeah, and truthfully though, like, I feel like when it comes to report sheets, it might be, or keeping them, it might be controversial. Like, I'm in agreement with you. Like, I have kept mine. I do from time to time keep mine. I really get rid of them only if I feel like I've had an assignment that, one, I'm on like my last day of a stretch.
Yeah.
Or I'm like fairly certain I won't ever see these patients again. I just get rid of it.
True.
But yeah, if I feel like someone's a frequent flyer, I'll definitely keep it. It's useful, especially that first report sheet where I write everything out and I make sure it's more detailed. Because on day 2, 3, 4, 5, I'm a little less detailed because now I feel like I know this person a lot more.
Exactly.
And I say it's controversial because I think a lot of people will say, oh, no, you got to get rid of it at the end of your shift. That's why the shredder's there. You don't get rid of it. But I agree. I think it's very useful to keep.
Yep.
And I think as a new nurse, you get to see, if you keep it and you really do take a look at them and go over it, I think month to month, you'll see the changes that you've made and where you think you can improve and all these things, even just in your report sheet. And it'll make you or help you give a more effective report as you get more organized with that. But yeah, I agree with you. I think it's something.
No, I always kept them in my locker. Sometimes they'll be in my bag, my back pocket. Yeah, you just never, you never know, right? But no, you are right. It is controversial, confidentiality and all that, HIPAA violation.
Yeah, as long as you keep it in a safe place.
Yeah.
I mean, you're not violating anything. I think that's the big thing.
Definitely. So for you currently right now, do you make a report sheet, or are you the type of nurse that goes in now and you're confident, they tell you report and you just
No, I definitely make a report sheet. However, I feel like now I don't need to write as much, and I'm very more targeted on the reason they're here.
Yeah.
So, and there's times where, because again, I don't come to work early. There's times where I'll get to work and, we get a lot of new nurses on our unit, and they're like so excited to, give me the full rundown on the patient. And usually, honestly, I'm down to hear it. I'll listen to your report. I'll even tell you where you don't need to let me know where you could do better, all that stuff. But there are times where I'm like, no, I don't need to know this. I don't need to know this. Skip through this, skip through that. Where I just know what I need, even if I've never had the patient. Like, they're telling me something and I'm like, you just tell me a story, bro. Just give me the goods.
Get to the point.
Give me the goods and you can go home and sleep.
Yeah.
You know what I'm saying? So when you look at my report sheet now, if you were to look at my report sheet now, I think you would be like, how do you know anything about these patients? Because I get like, for me, it's just like their name, their code status. A lot of the time, I really don't even need to know their age, truthfully. Like whoever MRP is, and
Right.
then
Are they on oxygen?
yeah,
IV.
of course. Do they have a catheter?
Right.
Are they going for a surgery or any imaging
Diagnostics.
procedures? You know what I'm saying?
Labs.
Right. And then the last thing for me, and obviously the history is important, allergy is important, but then what their plan is. Like if someone's going home today, I need to know I got to
definitely need to know that.
You know what I'm saying? Or where they're going. Do I have to give report to wherever they're going and all these things, right? So, or if they are going home, do we have to help set up home services and everything, right?
Right.
So, but if you were to look at my report sheet now, it's definitely more bare than it used to be. But as the day progresses, I do add to it. So
Sure.
if orders are changing, I'll write that down. If, I don't know, if like like imaging and x-ray result came back and I got to look at it, I'll write it down and all this stuff, right? So just various things like that.
They need to be NPO by midnight.
That's
or
right.
You know what I mean? Those are key things. No,
Yeah.
for sure. For sure. I agree with you 100% there. But yeah, for the like I said, congrats to the graduating class right
Yeah,
now.
congratulations, guys.
It's a huge accomplishment, and
It really is.
and if you didn't make it, it's all good. Don't stress.
That's right.
I've been there myself earlier on. Just get back into it, thug it out, come back next year stronger, fresher, sharper.
That's right.
And you'll get it and you'll pass. But honestly, you're not missing anything.
No, and just remember the most important thing is if you're early, you're late. Juniors,
What was it?
if you're on time, you're late.
If you're early, you're on time.
Shout out Coach Carter.
Yes. Yes. Remember that quote, nurses. That is key.
That is very key.
That's the one thing I want y'all to take from this episode. For real, for real.
Oh, man.
So that's episode 3.
Let's go.
Episode 4 coming soon. Enjoy.
Yeah, man.
Congrats.
Congratulations, y'all.
Oh, man.
That was funny as hell.